name's Dr. Michael Varveris. You can call me Dr. V if you want, if Varveris is a little too complicated for you. I'm here at the Medical Director in Naples, Florida of the Heart Attack Prevention Institute and Wellness Center. What I like to focus on at my institute down here with my patients is establishing an effective doctor-patient relationship based on good communication. I've realized in my life that the greatest skill anyone could have, probably, and myself definitely, is the ability to communicate. So obviously if a doctor and a patient don't communicate well, good things aren't going to happen. And I do get feedback from my patients that supports me having good communication with them, and I'm always attempting to improve myself. Now what I do here at my institute, among other things, is focus on addressing cardiovascular risk, heart attack, stroke, dementia, diabetes risk in patients. People who have these disorders are worried about developing these disorders. And what my goal with that patient, if they want to do this, and obviously most patients will since it makes sense, is to achieve the lowest possible future cardiovascular risk with the least amount of pharmaceutical drugs required. Now in order to do that, if the patient wants to do that, and I pray that they do, now in order to achieve that, what needs to happen is the body needs to get into the appropriate balance. And many things are involved with this, but the primary centerpiece of this imbalance is the body being overweight. This is true, we see this out there, people are getting more and more overweight, and the reality is that that plays in so much into these cardiovascular issues, and effectively improving that to get to the appropriate weight and maintain that weight many times either corrects these issues or gives so much benefit. And that's what I like to focus on and work with my patients, is effective ways of losing the weight, maintaining the weight that don't include crazy unhealthy diets that people probably shouldn't be on anyway and surely shouldn't be on long term. Or of course starting some crazy exercise regime of an Olympic athlete that's just not going to happen, is not realistic. It's going to include dietary change, it's going to include exercise, but things that work and people can do, and I assist them with that. So again, if you're interested in getting a doctor who's interested in communication, enjoys communicating, wants to communicate, wants to view himself as your personal health and wellness advocate for you in terms of cardiovascular disease, weight issues, and all kinds of other stuff, please consider me Dr. Varveris. Thank you.